I have a rant about surgeons. It's something I've avoided talking about for a long time, but to be honest, so another patient told me a story today. It's something I think we really need to discuss. So I had a patient who came in today, a little bit older, someone who's having some neck issues, they're having some other issues with dizziness, some things with their balance, some headaches, some things that we see commonly here in the practice. This patient, they're a little bit older and it's something that started more recently. Before seeing me, the patient has already been to see their doctor. They refer them on to a surgeon. In this case, it would be an ortho. And the ortho has basically told them that, yeah, we see some problems in your neck. Looks like it's an issue and we should probably do a surgery. Saying they're going to basically put in some spacers, which means there's going to be some metal in between some of the joints. So it's going to separate them to take some of that pressure off. And don't get me wrong, there are definitely some cases where this is warranted. Say if somebody has a chronic problem and they've already tried a bunch of different approaches, they've tried medication and they try more conservative approaches, whether it's exercises, stretches, seeing a chiropractor, seeing physios, seeing osteopaths, then yeah, maybe it would be an advisable thing for them to do. Or maybe if it's something which is much more serious, like say if they were having some urinary issues and it was starting to affect how they would balance very severely, or it was affecting how their control of their legs, or something where they genuinely might lose control of their arms or their legs, something which could be really threatening to their daily health or actually to their life, then absolutely a surgery makes sense. It's like if someone has a car accident, don't take them to see the chiropractor or the physio, go take them to a hospital. However, in the case of this patient, I've seen the MRI results. It's not perfect, but to be honest, it could be much worse. And it's a problem that has been chronic, but it's not that chronic. It's something within a year. It's not like someone who's had 10, 20 years and they have all these other red flags, or they have a history of fracture or some other issues. And for this patient, he's tried some medication, but he wants to avoid it. But otherwise, he hasn't tried anything that conservative apart from massage. He hasn't tried any, say, exercises, seeing a chiropractor or anything else, but the doctor has reverted straight to, we think we should do surgery. And again, don't get me wrong, this is not a problem I have with all doctors or all surgeons. Only a very small amount of people this happens with, but I do hear this story over and over. And the story is always just like this. Someone who's been for maybe an MRI, a CT, an X-ray, there are some findings, and instead of going for more conservative care, the doctor wants to go straight for surgery. And the question is, why? So one of the first questions I asked him, and I was kind of expecting an answer to come from this, how old or how experienced is the surgeon? And the man told me that the surgeon was quite young. He was in his late 20s. And again, I'll repeat, this is not a problem I have with all doctors and all surgeons, and even not all young doctors and surgeons, but there is this select group where I just keep hearing this same story. And this isn't something I've just noticed or made up myself, something that I've been told by spine surgeons who have more experience here in Singapore, and they see this pattern going on over and over where someone comes to see them after they've already been for a first opinion from a young surgeon. And what these older, more experienced surgeons told me in the past is basically that these younger surgeons don't have as much practical experience. They have, of course, what they learn at university. Maybe they're extremely skilled, they're extremely knowledgeable, but they don't have the practical experience with real patients. So they look for basically any opportunity where they can do a real surgery. There was a case I saw about 9 years ago where the patient was 18 years old, did not have a significant spinal problem or any kind of severe scoliosis. He was still recommended a surgery. And as this surgeon explained to me, of course, he never gets to see a young spine. I'm a full advocate if surgery is needed for anybody. Whatever the case is, if it's something extreme enough, I will refer patients, and I have referred patients out to go to their doctors or to go straight to A&E if there's a true emergency which might need a surgical intervention. However, if someone is a young doctor and the patient gets scared because they're told that they need surgery, even though their case is somewhere between mild and moderate, there's something wrong with them. And while someone who's older and has a lot of experience isn't always necessarily going to be more skilled than someone who's young, there are some great young doctors out there, people who really do care. There is a bit of an issue if people are just willing to take risks, because there is risk for this for the patient, just because they want to get their hands on more patients. And I want to make sure that people understand I do not have a problem with general doctors. There are some great doctors doing great things, and especially if things are at that emergency level, it's absolutely needed. However, if you do get a recommendation from a surgeon, and maybe you're not sure about it, maybe you think your case is not that severe, or maybe if you haven't even tried something that's more conservative, you don't have to come and see me. You can try something else. Make sure that you do take that more conservative route before going to something as serious as surgery. And make sure if you're not sure, ask questions or get a second opinion. That's your right, as is to keep any kind of images, x-rays, or anything else that they give you. They are your views. That is your right.